Good afternoon, everyone. I'm happy to be here. Yes, I was going to, before I talk about trends in health insurance coverage, I was going to say that prior to my coming to Urban Institute, and I've been at Urban about 2 years, I was the Deputy Assistant Director for the Health Division at the Congressional Budget Office. And I oversaw a lot of scores, a lot of reports, and worked with a lot of people there. One of my areas of expertise as a result of that and my research prior to the CBO, and I continue, is the area of microsimulation modeling. So the Congressional Budget Office maintains and developed a model to assist in scoring major policies that affect insurance coverage. The Affordable Care Act, expansions to the Affordable Care Act and so forth, expansions to Medicaid, and then the costs to the federal government associated with those expansions, or in some cases rollbacks. And so yeah, so there was one question in the chat about working on Capitol Hill. I just want to say that I work with a lot of people. Yeah, I have a PhD in economics, but and many of my colleagues do at Urban and CBO, but many of them have masters in public policy, public health. A lot of the people that I work with have specialized in big data, data analysis, and have a lot of programming skills, because that's the name of the game now in terms of informing Congress, members of Congress, what's going on, what can we expect. We all need to understand what the data are telling us. And so that's just a point I want to make. Can I share my screen? I have a few slides.
Yes, you should be co-host. You should be able to do that. Mm-hmm.
Okay, great. Okay. All right, can you see that? No? How about that?
Yep, thank you. It looks great.
Great, okay. So I just have a few slides, and I was going to talk about recent trends in health insurance coverage, referring to work we've done using our microsimulation model. And the reason I'm relying on simulated analysis is because the fact is coverage has changed a lot in the last year and a half, and we don't really have definitive data yet to tell us what's going on. And by definitive data, I mean major household survey data from the National Health Interview Survey, for example. We have just one release from there, the Current Population Survey, the American Community Survey. We don't really have what we need yet from those big surveys. We have information from administrative data, like Virginia Medicaid is tracking its enrollment. We have information from the marketplace, but in terms of how many people are uninsured, we only learn that from survey data. And how many people have lost employer-sponsored insurance, we only learn that from survey data. Okay, so I'm just going to talk about what we think happened last year in the wake of the COVID-19 recession. And then I'm going to talk briefly about what we think would happen if the American Rescue Plan Act's temporary enhanced subsidies were made permanent, which seems possible. And so last year, when the recession, came out upon us and hit us all really hard, and everyone, lots of people lost their jobs, lots of people worked from home. So there are really two questions. We wanted to know how many people lost their jobs as a result of, how many people lost their coverage as a result of losing their jobs, And then how many people were benefited from the Affordable Care Act's enhanced safety net by enrolling in Medicaid or marketplace coverage in order to make up for that loss of ESI. And so some of the things we could see right away is the people who lost their jobs did not always have coverage through their jobs. Unlike the majority of workers, half of the US has coverage through employment-sponsored jobs, but a lot of people who lost jobs did not necessarily have coverage. And so we're going to look at that more carefully. I'm using, these results are based on the Urban Institute's health insurance policy simulation model, which we call HIPSM. There's plenty of information available on this on our website. It's based on data from the American Community Survey, and then we do a whole lot of projections to reweight it. And so here are our main results. And we published this report last July. And so we used data from the Department of Labor and the Bureau of Labor Statistics to look at exactly who was losing jobs. We connected that to our model. We sort of mimicked that exact as well as we could. We matched it by state, by type of, by occupation, industry. Those were the important things, as well as by state, and we matched to overall totals from the CBO. And so we project that there were about 48 million non-elderly, I'm focusing on the non-elderly population, 48 million Americans in this first pie who lived in a family where someone lost their job. Because we don't just look at the workers themselves, we look at all the family members, because some of them are covered by a family plan through that worker. However, what we found is that approximately a third of those who lost their jobs or lived in a family with someone lost their job were covered by insurance through another family member who did not lose their job. Okay, so this is like if one spouse has a office job of some sort and gets family coverage, the other spouse may have a temporary job or a lower paying job and not cover the family through that job, or not even cover themselves through that job. Here we see that these were a lot of these workers, waiters and waitresses, hospitality industry, retail. Some of them were on Medicaid to begin with, about a third. This is actually Medicaid and CHIP. So what that really means is a lot of their children, the children who lived in these families, were already enrolled in CHIP and possibly Medicaid. About 10% of them were uninsured to begin with. This tan color, 21, about 10 million people lost their health insurance because they lost their job. And so if we focus on them, so that we're supposed to be sliding over that 10 million, here, what did they do in response? What do we think they did? And this is a projection. These are both projections. This one is more grounded here in data, but it does involve some assumptions about family size and the nature of what other family members are doing, but it is grounded in data. This is our projection of how they respond to the loss of insurance. And again, we find that here about a third become uninsured, 3.5 million, about a little less than a third enroll in Medicaid, and about another third join a family policy that another family member has available. And then here, a small number go into the marketplace, not as many. Remember, they may have lost substantial income. However, so we're projecting about 3.5 million become uninsured. However, down over here is 4.7 million people who were already uninsured. About 500,000 of them lost income, enough income that they dropped below poverty and lived in a state that had expanded Medicaid and were able to sign up for Medicaid. So that nets out to an increase right here in this row, uninsured. We started at about 28.6 million. We're projecting an increase to 31.5 million. It's a net increase of a little under 3 million people. And so we published that about a year ago, a little less than a year ago. Was our guess correct? We still don't really know. The Congressional Budget Office later last fall projected about 1 million increase in uninsured, and we're projecting about 3. I mentioned the National Health Interview Survey. Data were released earlier this year for the first 6 months of 2020. And what it showed was a slight reduction in the number of uninsured, basically the very opposite of what you would expect to see. However, we don't know, there may have been some increased level of measurement error because so many people were at home due to the pandemic, were unable to answer. The response rate was substantially lower than it usually is. So I say I still don't really know how many people became uninsured last year. I do know, though, that the Medicaid rolls are increasing. And there's, because of the CARES Act, people are not disenrolling from Medicaid. There's a continuous coverage provision in effect that's probably affecting coverage this year. And one of my colleagues will be publishing on that, on our projection of how many people that adds up to nationally in a few weeks. But the next question that I think is kind of interesting is, okay, well, what's going to happen next year if the American Rescue Plan's enhanced marketplace subsidies are in effect, and what would happen if they were made permanent, which means they would have an even greater effect. So, let me go back here for a minute. The Congressional Budget Office has scored the ARPA, of course, already, and they projected a little over 1 million people would take it, would enroll in the marketplace, additional people, because of these enhanced subsidies. But we wanted to estimate what would happen if they were made permanent, and if the effects were what CBO calls fully phased in. That is, if people had enough time to fully respond to these new subsidies. That is, they included in CBO's estimate right now of about 1.5 million is the acknowledgement that not everyone may be aware of these enhanced subsidies. Some people may not find it large enough to change their behavior. There's some inertia built in there. There are other reasons why it takes 2 to 3 years for new subsidies to really reach their full level of effect. But when you have a microsimulation model, you can speed up time. And so we wanted to understand what would happen, what we think would happen if they were permanent. So here are the subsidies. They are much more generous. Here are the percents of income that you have to spend on premiums in the marketplace. And each row represents income as a percent of poverty. So even if you're between 100 and 138% of poverty before ARPA, you would have to spend 2% of your income on marketplace premiums. Under the American Rescue Plan, that's been reduced to 0. And that also affects people almost up to 150, almost to 200% of poverty. And the income requirements have been reduced. In other words, premiums have been reduced substantially. And then above 400% of poverty, people are now eligible for small subsidies. And down here is cost sharing reductions. These have stayed the same. So we estimated what would happen if they were made permanent, and if all employers, insurers, and people had fully responded to these subsidies. And we estimate that uninsurance would drop by over 4 million, by about 4.2 million people, and private non-group marketplace enrollment would increase by 4.6 million. And the actual marketplace, that includes the entire non-group market on and off. Actual marketplace enrollment we project would increase by 5 million. That's not shown here. One of the things that's going on that's really important that we can model is that as more people join the marketplace, their average risk, health risk, is actually lower than those who are currently enrolled. So people who are uninsured are guessing. In some cases, they're sort of healthier than average. They're taking a gamble. They're not signing up because in part because they think they can make it through the next year without health insurance coverage if they're lucky. And people who make that gamble tend to be, on average, a little bit healthier than those who are already enrolled. When you add over 4 million people, over 5 million people of that category, the premiums we anticipate would drop by about 15%. So that's a substantial drop, and that drop affects everyone. And so that contributes. There's a kind of a little virtual circle here that contributes a little bit extra to enrollment because of these lower premiums.